after the meeting, I can find this in the meeting chat. Okay, got it. So we'll give it a couple more minutes to let some people join, but we're excited for those of you who have joined us already and those who will come even after this. This is a new concept coming from the fact that we couldn't have our annual fall conference, and we really wanted to be able to connect with our members. So fair warning, I'm at home with 2 children and 5 dogs, so we probably will get interrupted. And I don't know where I'm at. I don't know what kind of setting this is. There is a chat function on Teams if you are on your computer. There should be like a toolbar that may come up if you hover over it, or it may be there all the time. And there's a thing that looks like a quote mark. And so if you pull that up, it'll bring a chat up in the right-hand side of the screen. And so you can certainly ask questions live. We'd be happy to hear your voice and to see you on camera if you're brave enough. Otherwise, you can just type in your question. There's Heather. Yay. And we will be happy to answer it. So I think we'll go ahead and just get started with some some introductions of the board members who are here. So I'll start. My name is Sarah Hewitt. I am currently the president of the Indiana Association of Occupational Health Nurses, although this is my last year to be president. So when the elections come up later this fall, we'll have a new president. And I'm excited about that. So, I work for a company called Our Health. We do on-site employer-sponsored clinics. And so it's primarily primary care, for family practice type setting, but we do have occupational health services that certain employers request, and so that's what I assist with. And then during this COVID time, I've become the company actually did not have an employee health person, and so that has become me. I have become the employee health department as well as the occupational health department. It's a department of one. Oh, you can't see my finger. Ooh, that's weird. But I have one employee, and that would be me. So how about Heather? Can you go next?
Sure. My name's Heather Young, and I'm located in Evansville, Indiana, so very southern part of Indiana. And I'm part of the elections committee this year. So I'm an occupational nurse at Meade Johnson. So we make Enfamil. So we are essential, and we have been going ever since day one. So happy to have everybody on the call.
Thank you. How about Lisa?
Hi, I'm Lisa Hensinger. I'm the director of Mid-Indiana, and I am working here at Still Dynamics. We're also essential. So we've worked as a great team throughout the United States. We have several locations through the COVID and continue to do so.
Great. How about Kara?
Hi, I'm Kara Tamolia. I am the director of Southern Indiana. I am the health services manager for Corporate Progress Rail, which is a Caterpillar company, and we are also essential. So I've been working from home and enjoying it. Anything else I'm supposed to add? Sorry.
No, I think that's good. All right, Tim, you're next on my list.
All right, can you all hear me okay?
Yep.
Very good. My name's Tim. I am an employee at Catalent Biologics. I actually an employee of IU Health stationed at Catalent. We make pharmaceuticals, so we are also essential. Everything we make goes into either a syringe or a vial. And I am part of the elections committee.
How about Karen? Are you able to speak? I don't know if we can hear you or not. Karen Schmidt. Okay, we'll wait for Karen. How about Shannon Berryhill? I saw her name is on here. Yeah. So this is the problem with Teams. Sometimes it's hard to unmute yourself. Okay. So besides Karen and Shannon and those who have spoken, any other board members on the call that I have missed?
Just as a reminder, you can go back to the invitation and dial in on your phone separately if you can't figure out your mute.
Perfect. Okay. So I have lots of things in my head that we can talk about, but I didn't know if anyone had a question that was just burning that you wanted us to go ahead and dive right in and speak about that. You could just unmute yourself or write a comment in the chat. So obviously, COVID has changed the way a lot of us are working. One of the things that we're struggling with in the outpatient clinic setting is availability of PPE. We were not high utilizers of PPE before, and some of our suppliers have said if you did not order, i.e., for instance, N95 masks before, you cannot order them from us now. We have struggled with trying to source it from within America, so we looked outside America and made a very expensive investment in a lot of the KN95 masks. And there's some KN95 masks that I've seen that come over the, I gotta, hold on. Hold please while I undo my background so that you can see my actual hands. So they don't disappear. Okay, there's some KN95 masks that go over your head similar to how an N95 mask would go. Those would provide a better seal in my opinion. The ones that we got shipped when we unboxed them were ones that just had ear loops. And so we're struggling with getting good fits on that. And of course, we only have one size of mask. You can't, in a pandemic, you can't be choosy between regular and small sizes. I've not been able to find any small sizes anywhere of anything. We've gotten creative with the use of ear savers to try to pull those KN95 ear loops back a little bit farther to create a better seal. None of this, of course, would be like OSHA approved, but it's just a matter of trying to protect your people in this kind of unusual time. So is anybody else experiencing anything out of the ordinary in terms of your processes?
Well, we've mandated across the U.S. and all the international sites as well, face coverings. So it can be, we've provided face coverings, but people can wear face shields, they can wear scarves, whatever, to try to make it comfortable. But you know, it's manufacturing, so it's hot. So
yeah.
That's our big challenge right now, is managing the complaints and the compliance.
Yeah.
I mean, it's miserable. I can't imagine.
Right. That's very true. I've been working with a company, one of our corporate clients sent out an SOS last night. So part of my knowledge base in regards to COVID is knowing everything in detail about how to do contact tracing, when is it a primary contact and a secondary contact, and what sort of restrictions or testing is needed in either of those options. And so the corporate client reached out to us yesterday and said, hey, we're following your advice about needing to take people out for a 14-day self-quarantine because they've had primary exposure, but the head honchos at the company want us to test them, get a negative result, and then if it's negative, send them back to work. So yeah, so I've had to try to explain some of that, get some extra guidance from the CDC where I can kind of quote from their contact tracing booklet, the part about, that's great that you have a negative result on, let's say, day 5, but that doesn't mean you're not going to turn positive sometime else within this 14-day period.
Right.
But in their case, there's also some question, and I don't know how you guys are handling it, but from our health perspective, if everybody is masked, so if a patient and a staff member are masked, and later that patient turns up to be COVID positive and they've been in the clinic in the last 2 days, as long as everybody's been masked and we've been doing proper hand hygiene and cleaning, we are not considering that a true exposure. So the asterisk comes when we're having 10 to 20% of the people who come into the clinic decline to wear a mask. And so the CDC is very clear that if the source patient is not wearing a mask, even if the other person is wearing a mask, unless it's like a truly protective N95, and in this case it's been mostly procedural masks, then that does need to be treated as a potential exposure. So lots of ins and outs there. And if anybody has any COVID questions, I'm your girl right now.
Will you share your contact tracing with me?
Yeah, I mean, a lot of it's in my head, but
Okay.
so and the CDC has a fantastic reference guide and training program even for contact tracers. So I can share the link. I'm trying to think of if I can get email addresses of everybody who's on this chat or not. I can post it in the chat, and then if you come back out to this sort of Teams link, you should be able to pull it down. But while somebody else talks, I'll find and put it in the chat. But yeah, it's good. Of course, the guiding principle is who do you trace, and the who do you trace is anyone that's been within closer than 6 feet for 15 minutes or longer, and that time limit has changed since the CDC first issued their guidance, and where no one is wearing masks. So those are the criteria that we look at. Anybody else have anything they want to say so I can go look at source up? So exciting. How much COVID are you guys seeing in your locations?
So go ahead.
So I was going to say, so we have about 1,300 or so employees on site at any given time. And we found a loophole to get some of our folks tested whenever we wanted, way back in the beginning. So we've tested, I want to say 160 or so people based on symptoms. And we do contact tracing with each of them. So we've had multiple people out based on contact tracing as well. We usually let the people back in once the person is tested negative. The person themselves can't come back until they are both negative and symptom free for 24 hours. And then we've had about maybe 4 positives, and that's it. And a lot of those we caught before they were ever really on site. So.
Yeah, so I've had several different, this is Kara. I've had several different experiences, again, because we have facilities all over the United States, but our biggest one, so we have 3 large facilities, all that are around 1,500, and those are our 3 largest, and 2 of them have had no positive cases, which is amazing to me. And then one, which is in LaGrange, Illinois, when Chicago had that huge outbreak, they're very close. So we had 42 there, and 23 of them were asymptomatic because we ended up testing everybody that was working. So then we did heat maps, trying to figure out where it all, if there was a patient 0, in fact. But the fact is, you have no control of what people are doing in the community, or if they are going to tell you what they do outside of work. So, it's been a challenge because we're Illinois, kind of changed the way, basically, we're going to have a lot of work comp claims from that particular facility. Because it's very hard to prove
Yes.
happen outside of work. And that's why I was interested in your contact tracing, because I think we do a pretty thorough job. Even trying to get, travel and who lives with you, who stays with you, who's in and out of your house kind of thing.
Mm-hmm.
Exposure, again, just to try to make a case for not taking all these, but
yeah.
it is.
And to clarify, when I'm doing contact tracing for my own company, I'm not extending into like people's family households. I'll ask them, have they had an exposure? Have they been traveling to high-risk places?
Mm-hmm.
But our legal counsel weighed in and they're like, we don't want you they don't even want us doing it for our corporate clients because they feel like we're going to be stepping on the toes of health departments. Of course, we're nationwide. So
Mm-hmm.
Indiana, I don't think it's a problem. I know Indiana has historically been behind on their ability to do contact tracing within our state. But we specifically asked the question in, I don't even know, Virginia or North Carolina, and they were like, no, you will not. We were like, okay, I'm sorry. But
Interesting.
yeah. So I think you have to be careful when if you're starting to do beyond employees. I think it's one thing to help an employer out to say, let me help you identify who was potentially.
Yeah, we don't contact anybody but the employee.
Yeah. So I
just try to figure out what their exposures are.
Yeah,
What's that?
Sarah's personal opinion, and I'm not a lawyer, is that seems perfectly fine, and we're not replacing.
Well, I mean, it's gone through a legal team that, it's been pretty thorough. So
yeah,
mute real quick.
Sure. And of course, 20 to 40% of the people who are walking around with COVID are asymptomatic. So that does make trying to find that patient zero very, very difficult. We as an organization have made a decision that if someone in our facility has been diagnosed with COVID, in our facility or in our organization has been diagnosed with COVID, we will extend certain sort of protections to that employee, but we have to have a direct link or a known exposure before we're going to report it on the OSHA log. So, for example, we had somebody who, we had one person who was exposed to somebody who was positive COVID in the clinic, and her husband was a cardiovascular surgeon, and he was this is earlier on when testing was really hard to come by, but he was very insistent that she needed to go get tested. And so we got testing for her. She was completely asymptomatic, and she was COVID positive. So the whole time she was working remotely, so there wasn't any lost time to be considered, but that would still get reported on our OSHA log as because there's sort of a special reporting mechanism for COVID transmission or catching it in the workplace. So there's a special reporting, which I haven't seen. I don't know if anybody else has seen that, but I heard that it exists through our HR team. But then we had somebody else who no known exposure because everybody was working. We weren't seeing any patients in the clinic. It was all virtual care, and each person had their own room where they were isolated within a clinic. And then when they were traveling and through common spaces, they were required to wear a mask. So, no risk of catching the virus in the clinic under those circumstances. The person ended up being COVID positive and became very ill. And we ended up covering her PTO time. So not a reportable on our COVID work-related transmission log, but as a courtesy, the company decided to cover her. So not all companies need to do that or do that, just how we're handling that.
Yeah, so same, there's a bit, really actually pretty darn generous pandemic leave policy with Caterpillar. So if you are symptomatic, you can go out until, symptoms are cleared or you test negative or whatever. But anyway, they get up to 80 hours of pandemic leave for illness, up to 80 hours of pandemic leave for high risk, if they're high risk individuals. And then even more than that, and I can't remember the number of hours for childcare, but that one's not full pay. It's a percentage of pay, but so, it's great that they did that, but then you get into, the abusers.
Right.
Took it right away as vacation, and then, you know, they end up sick. And so
Yes.
it's just interesting.
Yep.
It's a whole new world.
So Tanya put a post in the comments. She said she is only asking to help determine if the employee is a direct contact or an indirect contact. And if the employee lives with someone who is COVID positive, then they will home isolate their employee. So that totally makes sense for sure. And I feel like I know things in and out, but today I saw a new thing in the CDC data that I'm sure it was there, but I just didn't catch it. So if you have that somebody who lives with somebody who's positive at home, so first degree contact with that in that close contact definition. I always thought it was just self-quarantine for 14 days. Let us know if you have any symptoms. And by the way, part of my job is if they don't have symptoms, I track them once a day. I am literally contacting people once a day. If they do have symptoms, I'm contacting them twice a day. So at one point I was up to 20 people that I was contacting twice a day. That was a lot. Okay, so we've had a comment that says, please mute your line if you are not talking because there's a lot of feedback. So, okay. Right, so the CDC says, if you have first degree contact, first you should go get tested to see your status, and you should maintain that self-quarantine during that whole time. But I was missing the part about them needing to have testing. So that's a change in my protocol today. So, what else? I mean, you guys want to just talk about COVID all day long? Because you know I can. So Tanya says the 14 days actually starts when the COVID positive individual is symptom free.
Yeah, so I don't know if can you hear me? I just took myself.
I can hear you now.
Sorry. Yeah. So the thought is that you're continually being exposed because we can't, monitor the positive individual, and home isolation is difficult, especially if you have a small home or whatever. Trying to keep that social distance isn't always, it's like you were saying earlier, they may not tell us the truth. So we actually start that 14-day home isolation time clock for our employee when the positive individual is better, right? When their symptoms subside. And that's when we actually started. Because so an employee could potentially be off for quite a while.
Yeah.
But what's really nice, it's like Kara was saying earlier, I can't see your name. I think it says Kara. Earlier that, the policies that have been put in place through HR and through our regional medical directors, it's pretty generous, right? And we're really going based off what the employee is telling us, because we're not requiring at this point for documentation. We do have them call our third-party vendor for short-term disability, so it is covered under that. So it's just, it's been a roller coaster for sure, and changing, right? The activities change along with whatever CDC puts out or whatever our regional medical directors from a global perspective come up with. And so it's been an interesting road for sure. So.
Yeah, and for a while there, CDC was making changes, I feel like daily, but they weren't tracking it. They weren't say like effective this day, this thing has changed. They made major changes to their symptoms. First, it was, cough or shortness of breath, and then 2 or more of the following, so that's where the headache and body aches and chills and, all that other stuff, loss of taste or smell, that came in. Then they combined it all. Then they removed headache. Then they threw headache back in, and then they threw some other symptoms back in. It's like, people, like we require our employees who are working inside a facility to take a daily symptom survey, so they do that electronically. And if the CDC keeps changing the guidance as to what questions we should be asking, we have to keep updating that form. So
Yeah, anymore, I've seen so many just random symptoms. I
Yeah.
just, if you have anything out of the norm for you,
yes.
aches, pains, fatigue. I had somebody with COVID toe, those red cells
Yeah.
got admitted, and then somebody just with really, really intense eye pain and irritation that was positive. So, I mean, it's just crazy.
Yeah.
Wide array of symptoms that present.
Totally. I was reading the other day that just random eye watering in one or both eyes is now considered to be connected with COVID. So not so much redness or irritation of the eyes, which I've seen for a long time, but just watering. Like,
Wow.
oh my God. And so then part of the survey, we have to distinguish between, because it's allergy season, right? And so it's like, oh, well, this is just my normal allergies. I need to know the difference between your normal or like.
Well, and Sarah, I'll tell you, I've had at least 3 people that thought they had allergy symptoms or sinus infections, which are totally normal for them this time of year, and went on to test positive.
COVID, yeah.
Again, you just never know.
Yeah.
My favorite is when they come into your office and say, I know it's not COVID, but these are, I have to tell you these.
Right.
Yeah.
So
It's
Connie,
not COVID, but I don't. So bye.
Right.
Well,
so Connie asks, oh, sorry, go ahead.
Oh, that's okay. What I was going to say is, we, our nurses are vetting all of the employees on, their symptoms, symptomology, getting them to clinics to be tested. And then one of the things is, we also, if they're asymptomatic and have tested positive, that it has to be at least 10 days since their positive test before they can come back, and they have not had any symptoms since they, tested positive. So that's really important, because now that you have people who are testing, positive without symptoms, you can't go by the symptomology to allow them come back. So we are following, those guidelines. And, right now we're just in a position as our company is that we do have different medical surveillance that we need to do, and just getting back to doing some of that and just finding a way that we can do it where it's safe for both our nurses and then safe for the employees to come into the clinics to be able to get some of those tests done.
So that is a perfect segue, because Connie's question is, what are you doing about annual audiograms? Are you testing? So, I don't know.
So I mean, we have some of our facilities that continued to test through all of this. They had a system set up where they were able to, do disinfecting in between. They could schedule them so that they didn't have more than one person in their office at one time. And now all of our other facilities have started to get back to doing the hearing testing. They're disinfecting the booth, the equipment, when it comes to, pens, clipboards, all of that. They have a system in place, and, we have also vision testing that needs to be done. So they're making sure that all those things are done and disinfected in between, so that we don't have any risk of transmission, and utilizing the scheduling more than the drop-ins. People used to just drop in and get their testing done, and they're going to, scheduling or having some control over that.
Yeah, and Tanya just put a great, because as you were talking, I was thinking, well, I could see how you could clean for things like vision testing and audiometry, but I really worry about spirometry and blowing hard, next to somebody. But Tanya said spirometry is being done at her location, but the tech wears full PPE with an N95, and the appointments are staggered.
I'm sorry.
One way into one way. Yeah, go ahead.
We are not doing spirometry. We're doing the medical questionnaires, and we're having those evaluated if for some reason something comes up, we're having those evaluated by either our company physician or another healthcare provider at this time. So we are not doing the spirometry.
Mm-hmm. Have you seen any guidance? Like, I know the DOT, for instance, put out a thing in March, I think, extending all renewals, all licenses until June 30th. Have you seen anything come out about like annual spirometry saying that it's okay to kind of delay that given what's going on?
I want to say there was something. I'd have to look it back up. I remember early on the clinic stopped doing it.
Okay.
Yeah, from
OSHA had something up on that too.
I think that's
That you, as long as you made your best attempt,
Yeah.
that you made your best attempt, that you could delay it until it was safe to do it.
Yeah.
And who was that from?
OSHA.
Okay. Well, right. And OSHA's requirement is that a medical questionnaire is filled out.
Spirometry isn't a requirement by OSHA, so we're not doing that until further notice.
Right.
We're doing what you're doing, Lisa. We're just doing the medical questionnaire, and then we're doing some respirator training. But other than that, we're not. And then audiograms will start up next week. I do those here in the clinic on site, so I will schedule a 30-minute session with them. Hopefully it lasts like 15, 20 minutes. And then I have another 30 minutes before the next person comes in so that I can clean the booth and let it dry.
Mm-hmm.
And everybody on site is required to wear the 3-ply mask anywhere and everywhere inside the facility. So we're doing that as well.
The other thing that we're having the employee do, and I think with places that, like Sarah, you're saying you have it kind of where the employee has to check themselves during the day. But before the employee can even come down to the health clinic, we actually have them call and we ask those questions. So we don't even let them into the clinic unless, they are cleared in that regard. So that's the first step. And then we have them do like hand hygiene before they even enter the clinic. And then they come in, and then of course, like it's a specific way in the clinic and then back out the back door, which has been kind of difficult because you're in such a routine of when you're done with your appointment, you take them right back out the way they came. It's just ingrained. So it's been interesting to kind of have to really remind people, okay, remember, and there's arrows on the floor too. So those have become kind of just obsolete, right? Nobody even sees them. So it's been a challenge to kind of think about how you kind of reopen, if you will, the clinic and the things that you have to think about doing that. So,
Tanya, do you find you have good compliance with people coming to the clinic, doing the steps you're asking them to do? Because we had signs and everything, and people just, they weren't reading. They just
no, I think that's part of it. We have this huge stop sign when you first walk into the clinic, and the doors to the clinic have remained pretty much closed. And we share our clinic space on the outside, at least in the waiting room, with our facility, with our fitness center. So of course the fitness center is not open, so the doors are closed at this point. And so I think the stop sign helps, and the fact that our volume isn't that, we don't have very many people on site that are coming down anymore. But we've had to change the way we have it. It used to be just kind of an open door policy. People could just show up, and now they can't unless it's an emergency. And then the emergency process that we follow prevents them from coming down to the clinic unless we bring them down. IHS brings them down. So yeah, it's been interesting, but I think the call prior to the appointment has helped quite a bit as well. So
good.
I have a quick question. It's kind of off topic a little bit.
I think we're ready for a topic change.
Well, it kind of is and kind of isn't. So I have an employee, and I need your help with this. She went out in early March with COVID-like symptoms. So it was way back in the very beginning. Her biggest thing was a low-grade temp. She's been having this low-grade temp. So she's now seeing 2 separate physicians, and they're saying that she's got this low-grade temp that continues to this day. So all these months, and there's no known origin. So she wants to come back to work. And so I had meeting with HR today, and I said, well, I need a note from the physician saying that A, she's not contagious or infectious, and I need to know when are they concerned with her temperature. So for you and me, it would be 100.5. Is hers 101.5 or what? And so what do you guys think? Have you ever dealt with somebody with chronic low-grade fevers, and what could that possibly be in this time of COVID-19 craziness?
There's lots of things in the brain, internal thermostats and things, and thyroid functions that can go wrong. And
autoimmune stuff.
Yeah. But I would still use that same cutoff, and we use 104 or 0.4 or greater. So we don't go to 100.5. So if it's 100.3 or less, I mean, really, can we clear 100.3? But anyway, we do. So 100.4 or greater, then we would clear them in. So even though her, temperature threshold, I assume you're talking about like someone with a 97.8, normal temperature, and then 100.4. Well, clearly that's a fever, and this is so close to her low grade. What would you consider that?
She's been texting me every so often her temperature.
Yeah.
I don't know why, she just has. But it's anywhere from like 99.9, 100.8, 101.2.
I wouldn't let her in. I think you've got clear CDC guidance that says 100.4 or greater, do not keep them in. And I don't know that I would. First of all, I don't know that you would get a doctor to say, oh yeah, it's 100.8, it's totally fine, they're not contagious,
Yeah. So, but that's what I'm requiring is I need your doctor to say, before we let you back, your doctor needs to say, that you're not contagious or infectious, and needs to guarantee that. If he can't do that, then no.
I would think she would be at greater risk of infection herself. I would probably, me personally, I would stand firm on that 100.4 and say, if you can't get there, I'm sorry, but long-term, short-term disability, and then long-term, if that doesn't work out, I just think it's too crazy right now. Okay, Tanya says, topic change. Indiana is becoming a compact state as of July 1. That is true. And yes, so yes, Tanya, I have heard that is the case as well, July 1. And I think we joined like something crazy, like 24 question mark other states. Yeah. I read early on when they were talking about this, that when you renew, which is it this year or next year? I can't remember. Whenever we renew our nursing license, that to renew to become a member of the compact state was going to be something stupid like $10 more.
So we can't do it before then?
I imagine you could. I don't know the process. Has anybody else looked into that?
I have the link. I just haven't had a chance to kind of look into it. And of course, when you're we've got like 124 sites across North America.
Yeah.
And so it's going to be a wonderful thing to, be able to do that.
Absolutely.
Yeah.
I wonder if it's an auto, like, are we auto opted into being?
I don't know.
To being part of that? I'm not sure. But I do remember that there was a distinction between if you want a compact renewal, is an extra $10. So I think that might be just a money-making scheme. But Shannon thinks we have to pay fees to join that, which I guess that would make sense. Connie asks, what is the rule for checking hepatitis B titer? Connie, are you asking upon hire, or maybe I'll just start talking?
After immunization.
After immunization. Okay. I don't know the rule. The protocol that I've followed everywhere that I've worked has been, if I'm going through the process of immunizing somebody, I will check 30 days after the last vaccine to see if they have an immune response. However, upon hire, the CDC does not require it. If you have proof of 3 hepatitis B shots of somebody, the CDC does not require or recommend that you have to go check titers for healthcare workers at the start of employment. You can, but they're not saying you have to do that. What does everybody else do? Anybody else out there giving Hep Bs?
We do the same thing you just mentioned. We also give the option to opt out of all of it if they want to.
Yep.
Yeah, we do the same.
This is good. Non-COVID questions. I love it. Although I'm going to start struggling for content here in a minute. Oh my. What else? What other questions do you have? I rock. See, this is a rocking chair. This is my 5th workstation that I've tried since I've been home. I ordered one of those over-the-bed hospital trays that we are all very familiar with. And that's what I put my computer on because I have an actual desk, but it's too high for me. And so this was not good for my wrists. And then I can't really be anywhere else in the house because 2 kids and 5 dogs. And so it's not quiet anywhere. So this is the best I've got. For a while, I actually was working from my bed until I figured this chair out. And that was also not comfortable enough this day. What?
That's terrible. I know that's terrible. For my birthday, which was right around COVID time, my husband and kids had gotten me an adjustable desk. It's one that you can pack. It's only like 3 pounds. So I travel. So then when I travel as well, I can pack it into my bag, but you can actually expand it. And even if you have like a hard table, like a kitchen table or what have you, you could set it up and then you can actually stand and, put your laptop on it and be able to stand and do everything. So that's really nice because I'm not much of a sitter.
Yeah, that's great. Very good. Okay, not to go back to COVID, but I do have a question about how you're handling it or considering handling it. Obviously, we went through kind of the lockdown period, so there wasn't a whole lot. Everything, I feel like things kind of, at least for our own company, slowed down in terms of potential exposures or potential cases that we had within our organization. Now that everything's opening back up, and this week, beginning on Monday, I'm not sure what happened, but I had tons of potential exposure cases where patients had come through the clinic and later found out that they were COVID positive. So kind of working through all of those. And then today I'm having a lot of people who are now symptomatic all of a sudden. So it's leading to larger questions from our HR person just messaged me about an hour or so ago. And she was like, we need to talk about COVID and personal travel because so far we've been kind of hands off, right? Personal travel, the law is pretty clear that if it's your personal travel, your employer really doesn't have a whole lot of right to go digging around and saying you can't go to Florida or whatever. But now we're seeing cases like New York and Connecticut, and there was another state out east kind of came together and said, if you're returning from states that are high, like Texas, Florida, North Carolina, South Carolina, there were others, but then you need to self-quarantine for 14 days. So have you guys approached or have thought about personal travel in your organizations, and have you created any rules around that?
Yeah, this is Tanya. So we have, we kind of exactly what you just said. If you're traveling, the direction is if you're traveling back, if you're coming back to your home state from, we'll list what states they are. Like initially it was New York, and then we had the different places across the world. We would have them home isolate for 14 days and contact IHS, and then we would just track it and, make sure that they were okay, that they weren't symptomatic through their 14 days and getting them back to work after that 14 days. And that's kind of what we are doing now.
So if we have a protocol for business where like we have a committee reviewing business travel requests. And so like we would put the brakes on somebody traveling to Florida right now, unless they actually work down there, which is happens. But so when people are traveling for personal travel, let's say they take a week vacation in Florida and then they come back and now you've said, okay, you have to quarantine or self-isolate for the 14 days. How is that compensated?
Yeah, I think it's a good question. I think, if people can work from home, then they're working from home. I think if I'm kind of rationalizing it, they probably call our short-term disability. I think just simply because a company's asking them to stay home. But I'd have to actually look into that piece because when you're talking about it out loud, you're thinking, well, anybody can go take a vacation somewhere and get a 14-day vacation. So, and it's covered. So yeah, it's yeah, I get it. I'll have to look into that, but I know that, we just tell them to self-isolate for those 14 days. A lot of the people we have right now are working from home. There's a huge population that's working from home right now. So
we do have some disparity inside my company that I've worried about, but I haven't thought too much about it because I haven't had to deal with it a lot lately. But early on, we have anybody who is at it from the clinic perspective, if they're RN or above, they can easily work from home, no problem. They just take their laptop. We have some MAs or LPNs who are called clinic team champions. And so they have higher responsibilities and more administrative tasky type work. And so then they can also take their laptops home and work from home, if I have to put them in isolation or send them for testing or whatever. But then there's our population, and it just happens to be our population that makes the least amount of money and is probably in the most need. And we say to them, hey, really sorry that you got exposed to COVID, but now I need to send you home. And oh, by the way, you can't work during that time. We don't have a solution for that. The policy has just been, if you are able to work from home, like if there is work for you to do from home, you can do it. But we have not been able to do that for MAs and people who check in people at the front desk, that type of thing.
Yeah,
so I feel weird about that.
Yeah, and I think in that instance, we would have them under the short-term disability policy. They'd get paid if we were sending them home, right, because of their positive or whatnot. Yeah.
So can an individual company authorize short-term disability? Because I'm trying to think from just from my time when I was working at Ascension, so many cases for short-term disability got denied by Sedgwick. And so there's really not a medical diagnosis other than exposure to a communicable illness, perhaps.
Yeah. So the way they handle it right now is that our regional medical director meets with the contracting, overseer from our company, and they meet. And if those individuals make it on our COVID list that we use to track, then they get cleared. And so she works with Sedgwick to clear those individuals. So they're, because you're right. I mean, the thing is if we home isolate somebody because their family member is positive, they should, if they can't work from home, then they are covered under Sedgwick because we as a company are putting them off.
Yeah.
And it's kind of how they've handled it. And I don't know if that's because we're self-insured. I don't know if that's how you can kind of have a little bit more leeway or say in how you facilitate that benefit. So
okay.
Yeah.
That's a good one. I'll have to ask that question.
Yeah.
And then I wonder what code you could use. I suppose you could use exposure to a communicable illness or potential exposure to a communicable illness for travel from for that same purpose. Use that same kind of diagnosis code. Yeah. Who would sign off? Wait, just short-term disability. Do you have to have some provider somewhere has to sign off on that, right?
Yeah, and the more I'm thinking about it, I wonder if they code it differently in their HR system, that it's,
okay.
It's
special COVID pandemic code.
Exactly. Yeah. Who knows?
Okay. That's fair enough.
Who knows? I write their name on the list and I give them to Dr. Wolf and he takes care of it. So it's that's probably what they're doing.
Yeah.
From an HR perspective. Yeah.
So what's happening with your companies? Growing, are they shrinking? My company, for instance, is bye, Kara. See ya. My company is in the process of merging with another company called Marathon Health. They're based out of Winooski, Vermont. And so Marathon Health operates in 40 states. Our health currently operates in 8. Some of those are combined, so we won't have 48 altogether. But so we're in the process of growing, even despite this craziness. Any How has COVID affected the rest of your businesses? Come on, Heather, it's time for you to talk.
I would say for us, it is taking on maybe some additional roles. So, I work as a contractor for Mead Johnson. I actually work for Progressive Health. So, we have a lot of PTs, OTs, and so a lot of them were furloughed. And so we actually have brought some of them in to do our temperature screenings because we need to be here. The production is actually ramped up, and we need to be available 24/7. So that's how that's changed. And then also we have our production and lab running, but we still have a large number of people that are working from home. So we've also just tried to say, okay, how can we keep those people at home engaged? So we've done some, virtual weekly motion breaks and, some exercise at home type stuff for those, because they're working from home, we don't want to leave them out. So it's just changed, and it's, I'm sure like everybody else is feeling, I feel like things are changing weekly. So, unfortunately, we're kind of in the boat where if we ask somebody to stay home due to maybe even symptoms, so we're saying, well, don't come to work if you're sick. It's a little tough because their short-term disability doesn't kick in for 7 days. They have that elimination period. Mm-hmm. And then even then we can't say if that's going to be covered or not.
Yeah.
So that's difficult. I'm not part of HR and I can give my recommendations, but the company, is a global company and has their own policies. So HR global HR really drives a lot of that. So.
Awesome. Thank you for sharing.
Yeah.
Who else wants to share? We have others that have not talked a whole lot. Or Tanya, come on, girl.
You want me to keep talking?
Yeah.
I'm trying to figure out how to make the picture bigger on my computer now because I hit a button and it's small.
Oh no.
Oh goodness. Yeah, I think it's kind of interesting. I don't know how much you know about Corteva, but Corteva is the agricultural company.
Forever. That's what I know about Corteva.
Yeah. That sounds like a Cindy thing, I would imagine. I think
it's Janice White. That's how she's told me how to say it.
So it's the spinoff. It's a pure play agricultural company that spun off from the Dow DuPont merger, and we're just getting our feet wet. We're just a year old, and then COVID hits. We're not even a year old, and COVID hits. So it's been challenging to, try to put everything in place in the midst of COVID and all of those things that happen when you merge and spin. I spent myself 15 months as a project manager for the spin to help launch our electronic medical records for Corteva and for DuPont globally. So it was on the other end of the whole aspect. And then of course Cindy retired and I came back to Indy and took on her role. So yeah, I think the company is still growing. Of course, we're an essential business. We've got to feed the world, and so it's been interesting. It's been a really learning a lot. That's for sure. In a very trying time. So yeah. But overall, it's I think the company definitely is doing well and growing. We've had within our own clinic. Because especially in Indianapolis, but in our own clinic, we had the nurses rotated weekly. So we have 3 nurses and a nurse practitioner and 2 nurses. And then when we became essential staff on site, our population went down to about 300 people on site from about 1,500. So we just kind of rotated the nurses in weekly and kept one admin at the site, and then everybody else worked from home. So we're getting back to where I think as of July 6th, the week of July 6th, all IHS staff will be back on site. So managing social distancing at work, we all have our own offices, but it's, again, it's habit, you know, you just want to talk to somebody. So you go into their office or you congregate at a coffee machine or whatever it may be. And so it's trying to remind them, okay, we still have to social distance here at work as well. And meetings on Zoom, and we're just right next door is a little difficult too. So it's very, very different.
Yeah, the corporate office of Our Health is located just off the circle in downtown Indianapolis. And it's on the, I don't even know because I feel like I haven't been there forever. It's second to the highest floor, and it is all open concept. So
wow.
we used to pack 85 people in there. And then at the start of June, they said, okay, people can start coming back, but we can only have a maximum of 22 people. And you have to reserve your space. And so there's somebody who's kind of coordinating return to the office. And I was like, you know what? I'm fine. Because then all the Black Lives Matter riots happened. And so all the windows on the building were broken down. And a lot of the restaurants that I would visit down there got vandalized. And the CVS on the corner got completely like ripped bare. So yeah, I was like, I'll just put pause on my my monthly parking garage permit.
Yep.
And I'll just be here if you need me.
Yep.
So.
Yep.
Well, anything else for anybody? We got 5 minutes left, or I can give you 5 minutes back of your day.
Sarah, this was really good. I enjoyed it. And I think, I don't know how often you plan on doing it, but I think it's really an important platform for us to be able to get together and talk about, even not just COVID, but just Indiana nursing, occupational health nursing in general. So I think it's really good to be able to do this. I appreciate it.
Perfect. Yeah, I think we're going to try to do, I was just trying to remember like about 5 minutes ago, how often did I say we were going to do this? It was either every other month or every month, but I think we can do it every month. It's not hard to organize. And so that's, and if it's as easy as this, just talking.
No PowerPoints, no note taking.
Right? I know.
No action items.
Yes. All right. Well, thank you everybody for joining. I appreciate it. And hopefully tell your friends and let's try to grow this group.
Absolutely. Thank you.
Thank you. Bye-bye.
Bye.
Thank you. Bye.
Let's see. I don't know how to end the action. Stop recording.